Good morning. Welcome to our final presentation in our six-part elder law series. Today, partner Keith Huffman and attorney Michael Huffman will be helping guide you through in-home care options for Medicaid. This presentation, like our others, will be recorded for future use. We encourage questions in the chat feature, which is located in the top right of your screen. We will answer this throughout today's presentation. The microphones are turned off for the presentation, but will be switched on at the conclusion should you have any additional questions. I'm going to go ahead now and hand it over to Keith Huffman to get us started with the Indiana Plan for Aging in Place.
Thank you, Brandy. This is probably the most exciting portion of the series we've done so far. We do a lot of wills for people, and we have yet to write up the first will that says, I leave everything to the nursing home. That has not happened yet. Someday we may meet the guy who owns the place, but so far that hasn't happened. Almost all of our clients want to stay at home as long as they possibly can. Indiana has been very, very slow to the plate about providing dollars for care at home instead of institutional care. AARP does a survey every year, who spends money on institutional care and who spends money on services at home. We were 49th about providing services at home out of all the states. We have moved all the way up to 44, and Indiana has a plan of getting in the top 20, and we're going to explore that plan today. So if you want to move on. This information, you're not paying us, so this is not legal advice you could rely upon. We're going to go over a lot of generalities today and a lot of concepts, but in any particular situation, the specifics of that particular family are very, very important to be able to advise somebody as whether they qualify for services or not. So Michael and I are going to do the presentation today. As you see us, I'm the one with the jacket on, so you don't get confused. Go ahead, Michael. The PACE program is the program I am most excited about. So I'm chairman of the board of Aging in-Home Services of Fort Wayne, which is the area agency for Northeastern Indiana, the 9 northeastern counties. We have historically been out on Lake Avenue in Fort Wayne, and we have moved our entire staff to the old Physician Health Plan building across from Lutheran Hospital, and we have taken our property on Lake Avenue, and we have completely retrofitted into a community/medical center, and we're starting the PACE program in Fort Wayne. We received the approval from CMS on April 25th, and we're now going to start enrolling patients as of July 1st, which is the first time we've had it in Northeastern Indiana. And the question is, I get asked, what on earth is PACE? Well, it's a program for all-inclusive care for the elderly. Elderly in this particular situation, it's people over age 55. And PACE provides all of the care and services provided by Medicare and Medicaid as authorized by an interdisciplinary team, and they cover all additional medically necessary care not covered by Medicare and Medicaid. Now, what does that mean? Essentially, it means that our PACE program isn't limited in the number of services they can provide. So, and when somebody enrolls in PACE, the PACE provider becomes responsible for all of their healthcare costs, prescription drugs, doctor care, transportation, hospital visits, dentist visits, everything that you can imagine from a healthcare point of view. So with the PACE program, once you enroll, you never have to worry, are medical costs going to keep me from getting care in the future? And that even includes nursing home stays. Want to go on? All right, nationally, there are about 260 PACE centers in the United States. There's actually a few more right now. This slide's a little bit dated. 126 sponsoring organizations. We'll be the 4th one in Indiana once we got operational as of July 1st. So the idea here is that the PACE provider, most people who are going to be PACE participants are going to be dual eligibles, Medicaid and Medicare. All the spousal impoverishment rules apply. So in any husband and wife situation, and one of them needs this type of care, the spouse at home is going to be able to keep their assets. Most people that provide this are Medicare and Medicaid. Some people are only on Medicare and they're using this as a spend down. They would spend about the same amount they would have on assisted living to participate in this program. We'll go through and you'll see what the participant and family satisfaction is. It runs over 95%. I don't think of any other healthcare system that gets anywhere near 80% satisfaction from people. The idea here is that the people who enroll in this program need nursing home level of care. And that's based upon activities of daily living. We'll go through those in just a minute. But the idea here is to try and keep people at home as long as we possibly can. The other idea is try and keep these people out of the emergency room. When somebody 80 or over presents at the emergency room, they are almost always admitted into the hospital. Once they're admitted into the hospital, they're placed in a bed. Once they're in a bed, they lose 1% of their lower muscle mass every day they're in that bed. And all of a sudden they're not ambulatory, and so they're going to end up in a facility. The idea here is that we're going to work in Allen County with all of the different emergency departments to try and keep our folks out of the emergency room. PACE members, and one of the detriments of this is that a PACE member has to forego their usual source of care. So they're going to drop their insurance, they're going to stop all other providers, and they're going to receive all their services through the PACE organization. In Fort Wayne, we're partnering with Parkview, but we also have 26 other contracts that we've signed with service providers. So we have to have a nursing home on board, we have to have a dialysis on board, we have to have dental people on board. All those contracts are already in place. So the service package that we offer to people must include all of the Medicare and Medicaid covered services, but we're not limited to that. So if Medicare says you can only get 3 particular therapies, we're not limited. We can give them as many therapists as we want. Medicare says they don't cover Boost, we can give them Boost. If Medicare says we don't pay for home visits, we can pay for home visits. So the PACE organization typically receives 2 capitated payments each month, one from Medicaid and one from Medicare for dual eligibles. But we have the full financial risk of all these people's health care costs. We have reinsured for folks that go into nursing home. We have reinsured for people who have catastrophic coverage. So we as an organization are fiscally solvent and a lot of insurance products in place. The interdisciplinary team is extremely important as part of this. So the idea here is that we bring these people into our community/medical center 2 or 3 times each week. And we get to assess how they're doing from a healthcare point of view. And we can assess how do we meet the needs of this participant. And then we work together as a team to coordinate how they're going to provide these services, who's going to be there doing it. And we meet on a periodic basis to review the individual cases. Someone like the care management plan they would have if somebody was in a nursing home. This is something that has to be updated on a regular basis to make sure we're meeting the needs of the individual.
And one interesting thing about the whole interdisciplinary team here, I mean, they're talking to the drivers who are dealing with these people on a day-to-day basis here. Some individuals may be hesitant to say things to a medical person, but they can off the cuff say it to a driver. So all these people are speaking together, trying to give the client the best possible care here.
And Michael, you make a very good point. One of the problems in our area for seniors is transportation. As part of the PACE program, we not only become responsible for all of their healthcare costs, we become responsible for their transportation to and from healthcare. And so you see on the PACE interdisciplinary team, a driver is an important part of our team. Now they have no medical background, but we're going to train the drivers on how to observe people to say, all right, this person's limping today. This person's complaining of pain. Whatever they're doing that, we want the driver to be part of this so that they know what we're doing for the individual And if somebody is in pain or something else, the quicker we can intervene, the more we're going to be able to help the individual. And if you can imagine a healthcare system where we make more money based upon how healthy someone is instead of how many services we provide to them, what an innovation this is. But you look on here, you can see we have RNs, we have a home care coordinator, we're going to provide services at home, we have a PACE center manager, we have physical therapists, we have occupational therapists. At our facility, we actually have rooms that we're going to be able to provide those services right on site. And so this is all of their healthcare costs in one specific place. The enrollment eligibility, they have to live in the PACE service area. So initially, the PACE service area is going to be Allen County, Indiana. We hope at some point in time to do a spoke and hub thing where we bring in people from the surrounding communities on a regular basis. We're probably several years away from that. It takes a while to develop this program. We hope to have 300 residents of Allen County who need nursing home level of care participate in the PACE program eventually. One of the things that we have to be able to do is we have to certify that these folks need nursing home level of care, but they're able to live safely in the community. Now, what that means, in most situations, there's going to have to be family members or loved ones that are available to provide around-the-clock care for these individuals. We're not going to provide around-the-clock care. That's when they would end up in the nursing home. And the idea here is that we bring them into our center, the PACE participants, 2 or 3 times each week. So we get to observe them medically, they get more social interaction, and their caregivers get a lot more respite care. So if you look at nationwide, 90-some% are dual eligibles, Medicaid and Medicare. Some 9% are Medicaid only because they aren't old enough for Medicare, they haven't been on disability for 2 years or more. And some pay a premium. That is actually 1%, but recently it's changed. It's closer to 6% nationwide actually pay a premium for this. 95% of the participants in PACE live in the community. The other 5% are in assisted living or in nursing home situation. The average age for a participant is 76 years of age. It's 70% women, 30% men. I think we all know that women tend to have longer lasting disease and they live a lot longer than men do. The average person, if you look at the activities of daily living, dressing, bathing, transferring, toileting, eating, and walking, the average participant in a PACE program is going to need help with 3 or more of these activities of daily living. So these are folks that are in bad health, but we're able to help them. The average person that's a PACE participant has 5.8 chronic conditions. Many percent, 46% of these people are going to have some type of dementia. And you can see there that COPD is on there, depression, paranoia. We're going to be dealing with very sick individuals, but we have trained personnel to work with those individuals. So the idea here is that we're going to bring them into the PACE Center as often as they would like to, but we want to make sure that they get as many visits as they need from a health point of view. And we're not limited to providing services in our PACE Center. We can provide care at home. We can provide physical therapy, occupational therapy at home. We can have personal care contracts. There'll be a care manager for each particular participant, and the care manager will contact these individuals. So the focus of the covered services covers the whole gamut of health care. So it's primary care, it's specialty care, it's palliative care to make sure people aren't in pain. It's also behavioral health sciences. So these people are going to need therapy. A lot of this is socialization. So as one part of this, we're going to be working with the medical education program as they train young doctors. They're going to rotate through our program. We're going to be working with St. Francis and PFW So the nurse trainees will come through our program as well. We're going to want to work with the Boy Scouts, Girl Scouts, so we have more social interaction in our center. Those things are all going to be important for people. We want to keep these people integrated into the community. The PACE Clinic, the building that we have in Fort Wayne on Lake Avenue is about 1,800 or 18,000 square feet. So on the top floor, half the socialization, half is clinical area. The bottom floor, about half is offices, and the other half is PT, OT. There's therapy rooms, there's places that we're making the food for the day and that kind of thing. The idea here is that we provide all of these programs to people at no additional cost to them. So for the typical person who's on Medicare and Medicaid, typically in a waiver program, they're going to have a liability. In the PACE program, they're not going to have a liability. So they may have monthly income coming in, but they get to keep that income. What a novel healthcare system that is. And you can see a list of what is included, but again, this is not a limit. So vision, dental, hearing aids, laboratory x-rays are all included within this program. There is a picture of the building and it is gorgeous. You can't see it through this picture, but if you went to the back of the building, there's a woods behind there and it's all glass through that whole area in the back. And it is very, very nice.
Feels like a little forest oasis back there. We were able to tour the facility, and it's a wonderful facility. So we're really excited about getting the PACE program up and running in Fort Wayne. We feel it's going to be a very helpful, really awesome part of our community here.
Yeah, we were out there last one and there was an owl sitting in a tree looking in the window, which was really, really cool. So in the Indiana Plan to Age in Place. So we're going to talk about the waiver programs. So there's a lot more of a safety net for seniors than people are aware of. So the age and disabled waiver in Indiana covers people who are at home and people who are in assisted living. And the state of Indiana is drastically committed to increasing the number of people who are waiver recipients. As you can see, from 2019 to 2023, we're going to increase by over 12,000 people who are going to receive the waiver program instead of being in a facility. When the state provides services at home, it costs the state on average about $2,600 a month. If the state's providing services in a nursing home, it costs the state about $4,800 a month. So the state can increase the number of waivers. It's actually going to save the state of Indiana about $560 million a year. And interestingly enough, there are fewer people in nursing homes in Indiana today than there were in 2003. So despite the fact there's more than 500,000 more Hoosiers, and despite the fact that we're all growing older, I actually tell my clients the older you are, the older old is. But despite the fact we're aging, there are fewer people in nursing homes. And almost all of our clients prefer that. So the Medicaid waiver program provides services for individuals who meet the financial criteria for Medicaid and meet nursing home level of care, but can be at home with a little extra care. So most of these people are going to get somewhere between 20 and 30 hours of care each week at home. They're not going to get around the clock care because it's more expensive for the state to provide that. But they will get care at home so that they can stay at home and don't have to go to a nursing home. There are spousal impoverishment rules that apply for married couples. In the early 1980s, judges were going into nursing homes in Florida and they were granting bankruptcies and divorces because as a married couple, you could only have $3,000 of countable resources to qualify for Medicaid. So September 30, 1989, Congress changed all those rules and created spousal impoverishment rules. Indiana is a very generous state about those rules. And so it's fairly easy to qualify one spouse for Medicaid, and the other spouse gets to keep almost all of the assets. We do have an income cap in Indiana. So you cannot qualify for Medicaid in the nursing home or for waiver services if your income exceeds $23.82 a month, unless you create what's called a Miller trust or a qualified income trust. And the excess money goes into that program. It goes to help pay for your care. If you're at home, it's part of your monthly liability. But it's something, and then at the end of the day, you don't want money to build up in a Miller trust, because when the person dies, that money goes to repay the state of Indiana. So Medicaid provides services for individuals who meet the nursing home level of care. Those are typically meals, they're housekeeping, medication assistance. They're not nursing services, they're not doctor services. And then typically you would choose a care provider. When you get approved for the waiver program, you get a pick list of providers, and you can make a decision whether you want Angel Corps, Angel and Demons, whoever it is, to provide services at home to help somebody there. There's meals, there's housekeeping, there's medication assistance. If somebody is in the assisted living facility, and there are a number of facilities in our area that participate in the Medicaid waiver program, and that has drastically increased in the last 4 years. Typically, the recipient pays $794 for room and board, and that's for really a studio apartments. Facilities are permitted to charge more for larger areas, and the state pays the facility one of 3 different rates based upon level of care that they need. So the people that participate in our area, just recently, Ossian Healthcare, Adams Woodcrest has been added to that list. In Fort Wayne, Golden Years, Evergreen, Heritage Park, the Hearth at Sycamore, Park Place, Silver Birch, Heritage of Huntington, Heritage Point at Warren, River Terrace, and Christian Care. So there's a number of excellent facilities that participate in the waiver program that allows people to actually be in a facility, but they're treated more like they have an apartment as opposed to being admitted to a healthcare unit. So the attendant care services they receive are generally for bathing, toileting, dressing, shopping, homemaking. Those are the kind of things they get help with at home. We've changed this because when they originally started doing this, most of these were performed by a licensed home health agency or personal service agency. Many of the different providers that are associated with hospitals and hospices have got out of the home care business because with their licensure, they had to send nurses out, and it wasn't financially viable to be able to do that. So what's happened in here with the waiver care providers like Home Court have stepped in, and they've really met a need that needs to be done. They're not skilled medical personnel, but they can certainly do the companion things that's needed to keep people at home in Indiana.
And one of the most important and difficult things we see in our practice is caregiver fatigue. We have so many individuals who have been caring for their spouse for years, and they don't understand the toll it's taking on them. So getting help with just some of those day-to-day activities can be a huge weight off somebody's shoulders here. So we're really happy with the way it can help the caregivers in our community here.
Yeah, and the Bible for that is the 36-hour day. So any caregiver feels like it's not 24 hours. We've been working at this for 36 hours. And the other part about this is the average woman that drops out of the workforce to care for a loved one loses $300,000 or more of economic benefit in their lifetime. So they've not gotten the same wages, they've not gotten the same health care, they're not getting the same Social Security benefits because they don't have enough quarters of employment. And so the average caregiver, and women are much better caregivers than men. I know I have 3 sons and 5 grandsons, and my wife is worried to death about what Michael's going to do later on down the road. Here's something that's interesting. In 2015, Indiana spent 89 cents per resident on case management, while the US average is $8.06. That's something that they've drastically increased in the last 5 years in Indiana. If you look at the current statistics, we're closer to the $8.06, but nationally it's closer to $15. So, and case management can be very, very effective with the sickest of the population. That phone call to make sure that, hey, are you okay? Do you have your medicines? Do you have things? Do you have trips arranged to your doctors? Those don't cost a lot, but they can be very, very effective in reducing healthcare costs. So consumer-directed care, this is something that we don't have a lot of in Indiana, but we're going to see more and more and more of this. Some states have really done this. We have two programs right now, the self-directed care and the structured family care. And we don't have a lot of people participating in this. These are older figures from 2016. It's probably tripled since then about the number of people who do this. The structured family care is usually somebody the family member who lives there, and they're paid maybe $12,000 or $13,000 in a year, but that can really help out in a lot of situations and allow the people to get care at home so they don't have to go to a nursing home. You can also have family members that are paid by the organization, so it may very well be that if you're having Angel Corps do those things, they might very well hire a family member to help provide services at home. One of the problems with the waiver program is when that person comes to provide services at home, it's a stranger. And many agencies don't send the same person to the same place every day. So it can be a stranger. And if somebody has dementia, it's hard to have somebody they don't know come into the home and help out. So the more we can have self-directed care or structured family care, the better we're going to be in Indiana. And we're certainly lobbying for that all the time. One of the problems with the waiver program is that when you call up your local area agency on aging, which is Aging and Health Services in our area, they do an assessment to find out what activities of daily living you can do on your own. When they complete that assessment, they go to the state, and the state does a cost comparison budget to show it's cheaper. Well, they actually call it a service plan now, to show it's cheaper to provide services at home instead of in a nursing home. Once you get to that point, you can then file a Medicaid application for them. And once the Medicaid is approved, that's when you start getting services at home. Other states have gone to presumptive eligibility, where once you meet level of care, you start getting services, and then you have 3 months to qualify for Medicaid. If you don't qualify for Medicaid within that period of time, then you lose your services. They're temporarily interrupted until your Medicaid is actually approved. That's something we're advocating for Indiana, and hopefully we'll have that in the next year or so. So assisted living waiver changes. Michael, you might want to talk about the snapshot date.
So it's very important to understand the snapshot date for an individual. And the snapshot date is the date that an individual first goes into a hospital and or nursing home, and they're there for more than 30 consecutive days. So it's important for anybody to have a understanding of that date. And that means anytime within the next 10 years, 5 years, however long it would take before you need nursing home care, you're going to have to go back to that date and establish what you own financially to tell the attorneys and tell Medicaid how you're going to qualify for Medicaid. So it's important to understand that snapshot date if an individual has ever been in a nursing home and or hospital before in the past, to have that cognizant and to have kind of an understanding of the level of assets there. So that's kind of the concept of the snapshot date here.
And what that means is, let's just say mom and dad have $200,000. They're going to say, all right, as of the snapshot date, dad goes into the hospital on July 1st. He comes home August 2nd. He wants to qualify for Medicaid 10 years down the road. We have to have verification of what they had in writing as of July 1st. And if they had 200,000, mom gets to keep half, subject to a maximum and minimum. She gets to keep 100,000. So 5 years down the road, they only have 100,000 and dad goes in the nursing home, he's eligible for Medicaid right away. Now, for most waiver people, they've never been in a nursing home and or hospital before. So what happens is the state does the cost comparison budget. And once they are approved or targeted for services, the date we file the Medicaid application becomes the snapshot date. And I think we have an example a little later on down here.
Yeah, and even if we had one individual who fell off his roof and broke his back in 1990. So this goes all the way back to 1989. So it's important that individuals know how far back we may need to go in some instances here.
And I think the important thing about the assisted living waiver, there are lots of different services that are provided. So adult day service. So if you want to have somebody go into a facility where they're gone for the day and then come home, that's covered. There's case management that's done that. There's environmental modification. So if we need to put railings in the home, if they need to put in no slip carpets, there's home delivered meals, there's homemaker services, there's boost and all those type of things. You can get one of those personal service response things. You can have transportation. They'll spend so much to modify the home to make it handicap accessible. They'll spend money to get your vehicle so somebody can drive who can't use their foot, or something like that. So there's lots of different things that are covered under the waiver services. So here's an example with a friend of mine. And it just kind of I wanted to spell, how does this actually work? When do people get services? So in this particular case, we were hired in May to do this. Aging and Home Services completed their assessment in June. The cost comparison budget that showed it was cheaper to provide service at home was done on June. We filed the Medicaid application, which became the snapshot date on July 17th. We moved the assets around by the end of July to make them financially eligible, and they started receiving services at the end of August. And so what services did they get? They get help with transportation, they had home delivered meals of 2 per day, they got adult day services. In this particular case, it was the husband with Alzheimer's, and the wife was able to have somebody pick him up and take him to day services and bring him back 6 hours later. So she got all kinds of different curative care, and she could actually get some sleep. This person had sundowners, and she was very appreciative of being able to receive these services. There's also a program called Money Follows the Person. This is for somebody who's been in a nursing home and or hospital for 90 consecutive days. They still meet nursing home level of care, but there's extra transition community funds, there's extra transportation costs, and at the end of 1 year, they transition to the age and disabled waiver. So the idea here is to get people out of institution as much as we can. So this is a part of what is a demonstration program, and they are now, there's qualified residential settings, so people could be in a home that's owned by a family member. It could be an apartment that has a living, sleeping, bathing quarters. It could be adult foster care, where 4 or fewer unrelated individuals live together and Medicaid is paying for them to be in that facility. Or it could be an assisted living. This is just what you have to have for eligibility for the Money Follows the Person program. We're not going to go through that in a lot of detail. So you want to skip that slide. This is how you apply for that program if anybody's interested. You can always give us a call if you need any of these numbers or anything else like that. So generally, if you are in an assisted living facility, the idea here is that you're going to get a lot of non-medical services. You're going to get housekeeping, you get public, you get feeding, you get respite care, something like Meals on Wheels and that type thing. There are also what are called prior authorization. So many times people might need additional services. They might need a wheelchair. They might need a special type of vehicle. They might need out-of-state care. And the Medicaid office then has certain services they provide, and certain services that you can request through the prior authorization. And they have a whole manual that they say that lists what you can get. The hospital beds are probably the one that gets used the most. The non-motorized wheelchair is right after that, as is the oxygen therapy. So all of those things can be done through the prior authorization form. And those things are going to be very, very valuable to be able to allow somebody to stay at home. So what happens in here is when you call for the agent disabled family member, you call the resource center at Aging and Home Services. They have an oxygen counselor. They do all of this through telemedicine now. They're not actually going into the homes and doing services. They make a determination though, based upon, does this person meet level of care, based upon are there 3 or more essential daily functions they cannot do their own. Ordinarily, that would result in a face-to-face meeting, and they would go through. It takes about an hour and a half. They have all kinds of different forms, and they want to give them information about all the different services that have been done. Once they've completed this, then the patient is now considered targeted in Indiana, so that we're going to try and get them services as soon as they're financially eligible for Medicaid.
A little more in there about how that face-to-face meeting works. There's kind of, obviously the pandemic has changed how that's done. I did want to mention LifeStream Services is the gatekeeper for some of our southern counties, south of Wells County here. So we're happy to provide contact information for them as well, if need be here. A couple more things there about the waiver program.
Yeah, the idea here is when somebody's on the waiver program, they actually have what's now called a care manager. And that person is supposed to advocate with the state so that you get as many services as are possible. So the care manager is actually paid a monthly amount, about $125 per patient. And that's done through the Aging and Up Services or through LifeStreams. And the idea here is they become an advocate for that person so they can receive as many services as possible. Plus the care manager is checking in to make sure that they have the necessary food, that they have transportation, they have their medications.
Yeah, and if the individuals for these places, sometimes people don't think they're going to qualify financially. Obviously, talk to a lawyer or someone like that to help you with all the financial side of things. We can make that part of it work. So don't rely upon them to give you financial advice as such here.
Yeah, and one of the things that I wanted to mention too, there's a thing called qualified Medicare beneficiaries. So if somebody has assets of less than $7,600 and their income's under $1,600, they're struggling to make ends meet. And they can be part of the Indiana Medicare Savings Program, which is administered by the Medicaid office, even though it's a Medicare program. The state of Indiana then pays their Part B coverage. So their income goes up by $138 a month. They pay for their prescription drugs and they pay for their health care so they can drop their $200 supplemental insurance. So now this person who's $1,600 a month now has about $400 of extra money each month. So you're getting them about 25% more dollars. So it makes it more likely they're going to be able to stay at home longer. So there's a qualified Medicare beneficiary, a special low income Medicare beneficiary, and a Q1 and a Q2, which gets you a little bit of extra help. We really don't have time to get into the VA benefits today, or we're not going to talk about the choice program today. But those, again, those are all part of the safety net that's out there available for older Hoosiers. We talked a little bit about this. This is a person who's in assisted living. And again, there's like 10 facilities in our area. I should talk about the Silver Birch people roughly. They have just built 2 large buildings in Allen County in the Fort Wayne area, one south and one north, specifically for the assisted living waiver program. And the idea here is they're going to have a nurse there. They're going to be able to help disseminate medications. The person's going to be in a safe environment, but it's more like an apartment instead of a healthcare facility. And so there are a lot of empty beds in our area for the waiver program. And the person pays the basic rate of $794, but if they want a one bedroom, they may pay as much as $1,250. And then the state pays the facility one of 3 different rates based upon level of care they need. So the facility is looking for the state for most of the money that they get. The rates are somewhere in the neighborhood of 2,400, 2,700, and 3,000 a month that they're going to be receiving. We talked about the snapshot date a little bit. That just kind of tells you a little bit about it.
We recommend working with an attorney on this side of things. So that's where our job comes in, is to make sure we get all the snapshot date valuations and go through that whole process with you here.
Yeah, it's unfortunate the Medicaid program is so complicated and the rules change all the time. So this is an area where you either do this all the time or you don't do this at all. So we also always talk about hospice too. I should disclose I was chairman of the board of Family Life Care. I am now on the board of Visiting Nurse. We merged the 2 organizations just before COVID hit. And by having the 2 organizations join together, we could identify about $2 million a year in cost savings, which is a staggering amount. When you go on to waiver services or Medicaid, you always keep your hospice benefit. And you can receive the waiver program and you can receive hospice. And hospice is an excellent program for the right person at the right time. They work with the right, they won't duplicate services. So the hospice people, when they do their services, are separate from what you're getting under the waiver service. But it's an excellent program. The VA program also has home health care benefits for disabled veterans, and you can qualify for both programs. And again, they work together to make sure there's no duplication of services.
All righty. Well, I'm going to talk about a couple different things here now. We've talked a lot about care for individuals who need nursing home level of care. That's that waiver program, PACE program, things like that. But we obviously have a lot of clients that aren't ready for the nursing home yet. And so they want to just get a little bit extra help at home, make sure somebody's there at night for fall risks, things like that. So there's a number of different things that can be done before somebody needs that nursing home level of care. So the first question we often get is, can I pay someone to take care of me? And you can, but there are ramifications and pitfalls you can get into. And so it's important that when an individual is paying for care within the home, you want to make sure that if they are paying above a certain threshold amount, which is roughly $2,200, I believe,
It is.
that those individuals are properly paid. So you can't just give somebody money and say, this is payment here. That person actually has to pay tax on that money here. And so what the IRS has done, and they have a great publication, number 926 out there, that tries to explain how somebody can be a household employee to allow somebody to pay an individual, a family member even, out of their own money, and to help streamline kind of the tax reporting requirements, unemployment issues, things like that. It can help streamline that process so it's a much easier situation for an individual to handle as opposed to a company or something else. And one of the best things we've done and reasons we've used this is to keep peace within the family. If there's an individual who is doing the vast majority of healthcare for mom and dad, if they can get a little extra money in their pocket, then it can help keep the peace, and so they don't feel like they're being advantaged of. And so we just caution people against large out-of-pocket payments, especially to family members, because that could result in a gift penalty under the Medicaid rule. So it's important to understand anything like that.
Yeah, so when you pay the daughter, the sons aren't nearly feeling so bad because they can't help as much because they're all working 2 jobs to try and make it in the economy.
That's for sure. Another thing we do oftentimes is what's called a homeowner's shared expense agreement. We have the situation in which mom and dad want to downsize and move into a child's home. We want to make sure that any money paid from mom and dad to that child is, again, not considered gifted under the Medicaid rules. And so one of the simplest ways to do this is have what's called a homeowner's shared expense agreement. It's going to allow mom and dad to pay money to this individual each month as part of their cost of upkeep for the house, groceries, care like that. And so it's not just simply rent. So it can be an amount above a typical rental amount. And if you have this properly documented, it does not need to be considered a gift under the Medicaid rules. And so you can help get a lot of money out of somebody's accounts before they would need to go into a nursing home if you have a properly structured homeowners shared expense agreement. So that's something that's always available when mom and dad are moving into a house.
And a typical amount would be somewhere in the neighborhood of $1,500 a month. If the total household expenses are less than $3,000 a month, then technically the excess money becomes income to the person who is receiving the money.
Always good to know. We always have the question of, can I be paid for my services under a power of attorney? And typically the power of attorney document will have language in there specifically authorizing or restricting that individual from being paid for services rendered. Again, this can be helpful if one individual is doing a lot of the care. However, there are some drawbacks. One of the biggest drawbacks is it's taxable income. That individual must report that receipt of income and pay the proper taxes on it. And so a lot of times family members choose not to be compensated under this. And it's important to understand the difference between compensation and reimbursement. Obviously, reimbursement for expenses is different than an individual being paid for services rendered. So it's possible, but you want to make sure that everything is factored in, and that's going to be the best circumstance for your family here. Another popular thing that we see occur is what's called colloquially as the granny edition. Mom and dad are going to move into a child's house, but they want to make sure they have someplace to live with a little bit more privacy. And they want to make sure that, again, it's not going to be considered a gift under the Medicaid rules. So we have a form that we use in our office called an agreement on the use of home improvement funds. And so in that context, if mom and dad are going to be paying $100,000 for a granny addition to be built, we would want to have medical evidence that it is likely they'd be able to remain in this house for a good period of time. We have something from a doctor's office stating it's reasonable to expect they would be able to remain in the home for 3 years. We would note that a typical assisted living cost can be over $3,000. You factor that in and you can help families protect a lot of assets while making sure they have a comfortable place to live. And again, it's not considered a gift under the Medicaid rules.
And it's important under the Medicaid rules, if you can prove that the purpose of a transfer was for other than to qualify for Medicaid, there's no penalty imposed during the 5-year look back. And so by doing this proactively, we're rebutting that presumption before it actually occurs.
And just one final planning option that we like to make people aware of, and we really like to use this because it can be a very beneficial windfall to the family. And Medicaid has an exception to the transfer penalties, gift rules. If a child has lived with a parent for more than 2 consecutive years, they would be able to gift that residence to the child without any penalty under the Medicaid rules. It's important for the child to actually prove and establish residency within the home. So changing a driver's license address and making sure that's all done properly, show you're living in the home, but that can help provide evidence that as a result of that individual living with the child, they have not needed to go to a facility as soon. That can help exempt us. Again, we provide evidence to Medicaid and show why this is not a penalized transfer. And if we can show that a child has lived there for the past 2 years, and as a result of that child living there, mom and dad does not need to go into the nursing home as soon, you can gift the home without any penalty. So a very generous and very helpful form when somebody's been very kind within the family to move in with somebody and help care for them. So that's a very helpful rule under the Medicaid system.
So you can couple this with the household employment rules. So daughter has moved in to care for mom at home, and mom agrees to pay daughter $15 an hour for 40 hours of care each week. No requirement for overtime if the daughter's living in the home. So mom has paid the daughter over $30,000 each year for 2 years, and which has gotten the daughter a lot more Social Security credits. She has the money she can put it into her IRA. Mom has paid the expenses of the house and put the house on an 80-acre tract. So now, because the daughter has lived there for 2 years, mom can deed the house to the daughter when she goes into the nursing home, and she can deed the daughter any land that adjoins the house that's not interrupted by another owner. So we have the 80 acres worth $10,000 an acre. So mom has now gifted that 80 acres, 800,000 to the daughter without any taxes involved. The only tax she's had to pay is based upon her $30,000 a year she earns, and without any penalty under the Medicaid rules. And the daughter can then turn around and give part of what she's received to the other siblings, so there's peace in the family.
So kind of big picture here in regards to keeping people at home, aging in place. The state of Indiana is committed to it for financial reasons and for practical reasons, emotional reasons. Everybody would rather be at home. So there's a lot you can do to try to keep people at home and still qualify for public benefits. And we're here to help every stage of life for whatever you would need in those circumstances. So we're happy to open up for questions. If anybody has anything specifically they would like to ask here, we are more than welcome to open this up.
Looks like we did have a question on when will the service start? So one, they've applied for the waiver. They go ahead and start services. Is there a time of space in between where they'll be have to pay for everything up front, or is it one of those things where it'll be retroactive?
Generally, it's not retroactive in Indiana at the present time. We are lobbying to try and make it retroactive. There are some assisted living facilities that will allow it to become retroactive, just based upon part of their marketing efforts. But most facilities, you're going to, once you get approved for Medicaid and you have the waiver slot, you're going to start getting services forward, and you're not getting reimbursed for prior services.
And then there was also a question about PACE and the service area. Is it just a certain zip code or address for Fort Wayne, or is that open to other individuals?
It's Allen County right now. So anywhere in Allen County right now is the accepted service area.
Good. Does anybody else have any questions? I can open up microphones if there's additional ones. That was definitely a lot of great information. Thanks everyone for enjoying and joining us for this series. We hope that you have found value in both this presentation and the entire set of presentations, and that you'll join us again in the future for more educational sessions. The video of today's presentation will be available on our website or YouTube channel. If you have any additional questions, please reach out to us at admin@dhblaw.com. Or you can always reach us by phone at 260-824-5566. Thanks again to Keith and Michael for taking some time out of their day to present to us today. And everyone else, have a wonderful day.
Thank you.
Good job, Michael.